Of your program. This is part 2 of our program, and we went over some basics about what the nurse does and what circumstances in the last program. This one is going to concentrate on the exam itself. So this is part 2, and I always like to mention that I was a Girl Scout, formerly of Troop 151 in Burbank. The forensic examination. Now, sometimes you hear people call it a rape kit, but that's not really what it is. A rape kit is actually the duct tape, the gloves, the rope, whatever that person brings to that event. So we like to call it a sexual assault exam or a forensic exam or a SANE exam. SANE is Sexual Assault Nurse Examiner, and SART is Sexual Assault Response Team. So the SART is a bunch of people, and I assure you they're not all in there when I'm doing the exam. So we're going to talk about that a little bit. I need to move this thing maybe somewhere else. All right, we'll move it around when we need to. The medical legal evidentiary examination includes a head-to-toe assessment with the body map. We are nurses first. So when people forget that we're nurses and they clearly are just going into the forensic aspect, they're losing half of what they need to be doing. So we're nurses first and we're medical people. So we're going to do a head-to-toe assessment of that patient. We're going to collect reference samples. Now the difference is that when I collect samples, they don't go to the hospital lab as usual. They go to the forensic lab. We have ours downtown in our crime lab, and that's where those samples will be evaluated, not at the hospital lab. In fact, my last program, I was not in a hospital. I was on Fair Oaks Boulevard. So we're going to do body photography with and without a ruler. When I review cases, I've reviewed probably more than, I don't know how many, thousands of cases for defense. And what I see a lot of is that some programs will strip the patient naked and have them stand. This is horrible, horrible, horrible practice. I want to make sure that that patient is treated with respect and dignity, and we're not going to do anything. For example, the photography, I'm going to remove maybe one arm of the gown, take some pictures, what I need to see if there are bruises or what have you, put the gown back on, then do the other side. I'm never going to have a patient just standing naked in my room. Specimen collection. We collect our samples in sets of 2 or 4. Most all samples are collected with 2 sets, 2 swabs in a set. And that's because we want a sample for the prosecution to possibly have analyzed, and we also want one for defense. Sometimes they use up the samples in their first analysis, but we'll get a report, so that will make it easier. So the 4 samples, the 4 swabs held together are for the vaginal swab. We'll go in that a little bit later. We do not collect samples. We have to label them all. The little picture down at the bottom here, I don't know if you can see my pointer. Anyway, it's a swab drying box. And what it does is it has air that circulates through the box to dry the swabs. It does not blow the samples around, but it dries them in a forensic way. That way you can label them and put them in their individual envelopes to package them and know that they're not getting samples spread from swab to swab. We're going to take samples of the nails. We're going to swab the hands. We're going to do bite marks if there's any that are reported. Suction marks, touch DNA, all of those are going to have samples on them. So what the patient reports is what we're going to collect. Anogenital sample collection, obviously, we're going to collect samples from those areas. We're going to do photography. We're going to document what we do. That little thing is right in the way. Let's see if I can get rid of it or move it. And then after the samples are collected, we're going to put them in the dryer. We're going to do our documentation and then afterwards package the evidence in the proper envelopes. One thing that's involved is more than just an examination. We're going to do the evaluation, and we're also going to provide treatment for sexually transmitted infections and pregnancy. So after the examination, we're going to give you aftercare instructions, and we're going to also give you some medications to prevent sexually transmitted infections. We have a protocol that we use, and we also give pregnancy prevention in the form of Plan B. And we will also recommend that in 2 weeks, you go for sexually transmitted infection testing, because we will not be testing adults at the time. Another benefit is that we are mandated, actually law enforcement is mandated by law to have an advocate come and respond. Since law enforcement are supposed to be objective and the forensic examiner is supposed to be objective, we need somebody to stand with the reported victim and be her advocate. So the registered nurse is the patient advocate, but the advocate is the crisis advocate for the patient. And they can arrange some counseling for the patient, and if there's any other services that they need, they can step into that role. The photography involves well, we're moving ahead in progress here, but we use cameras, regular cameras, and we also use an instrument called a colposcope, which is this instrument. And what it does is it never touches the patient, but it has the capacity of photography and magnification, and that's what we use it for. If you go to your GYN, they may use it for diagnosis of certain conditions. We use it for the purposes of magnification. And like I say, it never touches the patient, but it gives us very good photography. We're using digital photography now. When I started, we were using film. And so everything kind of changed into digital photography, and some of them are not even using the colposcope anymore because we've progressed to the point where there are programs software programs that people can buy, and they do the work of all of this. Excuse me. We should take at least 10 to 20 anogenital photos, even if there's no injury, just to show that we were there. And that should not be ignored. The photographs are very important because they're going to back up what the forensic nurse has written and the documentation. Here's an example of using the colposcope on your $20 bill. This is magnified 9.3 times. This is magnified 34.5 times. So you can see that this is like inside the little zero of 20, and this is all along the sides that are written over here. So you can see that it's low magnification. I've heard on the witness scanners that say this is high magnification. It is not. 34.5 is low magnification. If you look into a microscope, you might find 750, 1,000. Those are different. That's high magnification. This is just low magnification. Here are my fingerprints. None of you have permission to turn me in for anything. But you can see that I can see actually right into the fingerprints. Here's some examples.
Cari?
Cari, I don't think your slides are changing. They're not changing with your presentation.
Is that right?
Yes. Do you want me to screen share the presentation instead?
Are they going now? No?
No, nothing's changing. It's still on the first slide.
I've been trying to, it says my screen sharing is paused. How do I unpause?
Okay, so click the button. If it says it's paused, there should be a drop-down menu and you should be able to click continue screen sharing. There you go.
Is that working? Okay, then let me make it bigger.
Yeah, much better.
Shall let me see. Are you seeing stuff on the edges there too, or shall I just continue this away?
Yes, you can.
So
I can see the slides on the edges, but it's fine.
How about now?
As long as.
Are you seeing the show?
Yes.
All right, let me backtrack just for a second. Here's that slide with the drawing box over here and the evidence. And so you couldn't use my fingerprints anyway because I didn't show them to you. All right, here's the money. See the money? Yes? Okay, then I'll continue. There we go. All right, the one in the top left, anybody want to shout out what that might be? I don't know if anybody muted or nobody's shouting. That's a cutter. That's somebody who cuts themselves.
Oh,
And
okay.
want to make sure that you differentiate that between injuries. You know, when patients come to us, they might already have injuries, bruises, this and that. If you examined me right now, you would find all kinds of scratches and bruises and things on me that have nothing to do with anything but me. And so you want to make sure that you have a differential diagnosis. So this is somebody who, for whatever reason in their psyche, are cutting and injuring themselves. The next one are some bruises. Some people might refer to these as fingertip bruises. I do not like to refer to those because I don't know what they are exactly. I can tell that they could be, and that's part of the differential diagnosis, but I don't call them fingertip bruises. I would call them 3 oval bruises. They look a little bit old because I can see the yellowing around there. Usually when a bruise gets older, the coloring reabsorbs into the tissue, and that takes a while. Bruises usually last from 1 to 2 weeks, sometimes longer, depending on the severity. This photo that I took, these are all my photos right now. This photo I took because the person said that her fingertail, when she was fighting her reported assailant, she lost a couple of fingernails. Here's some underwear. You can see that there's a hole in there. Do I know that it happened during the event? No, I don't know. But I'm going to go ahead and submit it. Luckily, I don't have to make those decisions. The pair of jeans that you see there, she had a bloody nose, and that's where all that blood came from. So you can see when somebody makes a quick judgment, you might be wrong. But yes, this is her from a bloody nose. I did a shot of this shoe because there were footprints at the scene, and I thought this might come in helpful. There's a couple. This one is a domestic violence. Most of our injuries, as we talked about last week or last time, are from people that know each other well, intimate partner, and that's where your most domestic violence, interpersonal violence, that's where you get most of your severe injuries. So this lady was in the hospital, and actually she had some internal organs that were injured. These are other just kind of injuries. Here's a scraped knee. This woman was one of my favorite patients, and I had her many, many years ago. Actually, when I was in Pasadena, I remember her. And this is a bite mark to her ear. And this is some flowers. Do you see that, Sila? Some flowers here, and this is the imprint of an iron. And to give a little bit of history on this case, I told her when she walked in the door that she was going to be in my presentations because he had fought with her on Thanksgiving, my understanding, and it continues to be true all of my 46 or so years of nursing, that holidays are very, very drastic times for some families. And so Thanksgiving, they had a fight. And then after Christmas, they had a fight. And this patient I saw the day after, I believe, New Year's. So this had healed already for the most part, but if you can look closely and see that that's a steam iron that he put against her. And so these are very important photographs to take, and I knew that this was a unique situation. So I had her put her hand over and, you know, make sure that I would be able to get a good picture to show you. And you can see that also this bite to her ear is also old because it's mostly healed. We use a tool called a Woods lamp. And a Woods lamp was something that we use in the emergency department to check for your eye injuries and things like that. But actually it evolved into an ultraviolet light, and it only has about 365 nanometers of power. It does not really fluoresce, they use that word, but it absorbs the light. And many substances will show up that are invisible to the eye. And I laugh a little bit because the Woods lamp is kind of an old-fashioned tool that we use. We have better tools now like the ALS, but the Woods lamp is one of those things that if I shined it onto my black top, you can't see I'm wearing a black top. If I shined it on there, it would almost be white with all the schmutz and the lint and the dust that's on it. And that's the kind of thing that shows up. Of course, that's not good evidence. We want to see if there's any stains or something that we might be able to take a photograph of. Next slide, I have some kind of a thing. But the alternate light source is a move up, and it has better intensity. It has 475 nanometers, which means it cuts some of the unnecessary things and focuses on the other. We wear orange goggles when we use this light in a dark room, and it's more discriminating. So, and again, the Woods lamp is still being used, but it's the least useful because it just shows everything. DNA sometimes will show, and it doesn't have to be. We don't know what it is. It could be amylase, which comes from the mouth and other mucous membranes. The DNA that comes from possibly semen, and we also have skin cells. These are set up with my alternate light source, and it's not specific again for body fluid, semen, or saliva, but I have heard nurses say on the witness stand that it is specific, and if they see a stain, that's what they think it is, but it's not. What things can show up? Creams, lotions, soda, acne, makeup, fabric, soap, thread, there's so many things that can show up. And so you can't say for sure what that is. The Woods lamp is something, you know, that ultraviolet light, that's what you used to use on your Jimi Hendrix posters, showing my age, sorry. So what will happen is that there will be a concentrated form of light that will show up. And if you can tell the difference in this slide, that I'm going to be wearing the goggles. I'm going to use my little tool, my ALS. I'm going to have my camera ready to take photos. And then when I show on that, there's going to be some sort of a focus. The other tools we use for females would be a speculum. And ladies know that when we go for our annual exam, this is the tool that the doctor uses to look into the vagina. And we want to make it clear that the vagina is its own structure. I'll go into that a little later. Here's an anoscope, and I can look into the anus and also into the rectum. The speculum is going to go through the vulva and pass through the hymen into the vagina. The anoscope is going to pass through the anus into the rectum. Toluidine blue is another tool that we use. It's a highlighting tool. It's a dye, and it only stains active nucleal cells. Okay, so nuclei is the center of the cell. That means that the skin has to be broken in order to expose those cells. The intact skin that we have on the surface of our skin has inactive nuclei, so it won't take up that dye. Now, the other thing is that there's light blue, dark blue, weak blue, purple blue, and purple blue is the only positive sign. So injured tissue exposes the cell nuclei, and the dye will uptake and attach. We put the dye on, we wait about a minute. I take photos in that minute, and then we decolorize the dye. In other words, wash off the dye with a solution. I use acetic acid. Some people use baby wipes, this kind of thing. But, and lubricant, but I don't like that on my hands when I'm doing this thing. So that's what we'll do, and we'll use that as a highlighting tool. The findings might have nothing to do with genital and anal findings. Body findings, if I fell down and scraped my knee and then something untoward happened to me hours or days later, they're not the same. So somebody might see an injury on somebody's body and say, oh, look, he hurt her. Well, no, they might have nothing to do with each other. So we have to be very discriminating in what we see and what we look at and what we come to a conclusion on. Now, the newest laws are that a person can have an exam without cooperating with the law enforcement process. I say new as of the last, I don't know, 8 or so years. And it used to be that when you had an examination, the exam form said that you have to cooperate with law enforcement. Well, some people aren't ready to do that, but they do want an exam. So there may be a time limit to the decision to report and have their evidence kit destroyed. Let me give you a little scenario. If a patient were going to come in and they said, well, I don't know if I really want to report this, but I do want an exam. So we'll have the patient sign the exam. We are mandated reporters, so we will report to law enforcement, but the patient will have that choice whether or not they want to do a continued evaluation. Now, of course, if you have the examination and you choose not to cooperate at that moment, what will happen is that if there is evidence at the scene or otherwise, that will be lost. They will not continue an investigation. What will also happen is that you will have a choice of making a decision. So, for example, let's say I'm going to collect your kit and I'm going to keep it for 6 months. And you have to make a decision in that 6 months if you want to make a report, if you want to continue with the investigation. So about month 5, I'll give you a phone call and I'll say, I have your kit and your time is running out. Have you decided that you want to continue or do you want to stop? And if they don't want to continue, the kit will likely be destroyed. We don't keep the kits. The forms, we keep some of the paperwork, but we don't keep the kits on site. Those go to law enforcement. So there will be a procedure that will decide, you will decide if you want to continue the investigation with that or to have your kit destroyed and you're done. So anatomical. What we look for is anatomically correct positioning, and that's what we use to fill out our diagrams. Excuse me. So anatomically correct positioning is standing upright with your palms out, facing out. So we want to use the correct terminology for the body structures. And as we talked about before, the vagina versus the vulva, they're not the same. Anatomical locations, we want to be specific, whether they're internal or external. So there are some parts of the genitalia that we consider external. And the vulva, for example, would be, some people call it the external vagina, which I know what they mean. Not exactly correct. So we want to get those correct and what is internal and what is external. We want to also use terminology that's correct and understandable. For example, when I go into court, I want to talk about redness. Erythema means redness, but not everybody knows what that means. So I want to use common terms that everyone will understand, especially while testifying. This slide is in just to show you what people don't know for the most part. And people consider all of this area the vagina, and that's not true at all. They have specific names, and I'll go over them with you briefly. But this would be, what we're looking at now is the external area, the vulva. And the vulva consists of, wow, where's my book? And the vagina, the vulva consists of the hymen, which is external, vestibule, which is beside the side, the fossa navicularis, which is here, and the posterior fourchette, which is the end right here. Now that is where you're going to find most of your injuries. Why? Because that's where the penis or the object, the penetrating object, most likely hits that area. And this is external, the hymen is external, and inside this area, the vaginal orifice, is the vagina. Common injuries that we see are tears, abrasions, and bruising. Findings, the same findings can occur with consensual sex as with non-consensual intercourse. So because there's an injury does not mean it was force. And we can't tell force. How do you judge force? There is no way to judge anogenital force. So we're going to find the same injuries in consensual as well as non-consensual intercourse. And the reason that we do is because that area is stretched. When two skin surfaces rub against each other, you're going to maybe get some kind of findings. 6 o'clock is always 6 o'clock. The reason I say that is because I did have a court case where the nurse examined the patient. This is 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock. We use the face of the clock. So what she did is she examined the patient and she said she had an injury at 6 o'clock. We examined the patient sometimes in the chest position. So she turned the patient upside down, but she called this area 6 o'clock again. If you turn your clock upside down, 6 o'clock is always 6 o'clock. So she totally got her testimony wrong and maybe hurt her case. The suspect exam is something that they do not have to consent for. We did consent on the last session. The patients in custody do not have to consent for the examination. It's pretty much the same exam, but we do not interview the patient regarding the event. And the reason is I don't know if that patient's been Mirandized. I don't know. I don't want to interfere with any police interviews. So I'm not going to interview him other than his medical history. For example, if he has heart problems or diabetes, I'm going to make a special note and give that to law enforcement and make sure that he gets the care he needs. I do ask about the time frame. Some of them, some of them are going to deny and they're going to think I have something to do with that, but I have nothing to do with that. And the police are with me the whole time when the suspect is there. I take the handcuffs off. I don't want them there, but they're never out of the presence of law enforcement. They're the same samples as reported, are the reported victim and suspect. It's just a little bit different. We'll do anogenital samples. We'll do samples of any injuries, bruises, suction marks, anything like that. Again, basic except for the separate anatomy, and everybody is treated well without judgment. I might appear in a criminal court as the expert witness who conducted the examination. Currently, I work mostly defense now, so I will be working with defense and looking over all the exam forms and the photographs taken by the examining nurse and making sure that they're there for accuracy and competency. And I do a few civil cases, but not too many. Every once in a while, there's a civil case that goes along with the sexual assault case, and I might do both. As a consultant, it is my effort to review and assess the work of the examiner for accuracy and objectivity. We do a type of peer review when you have work of other people's and you go ahead and review it. Sometimes you do that on a peer review base. Sometimes you do it for their employment evaluation. And sometimes you're going to do it for each case that that patient, that nurse does, and you're going to make sure that they're up to par with the standards. Hopefully it'll be a learning experience because we'll give feedback to that nurse and we want everybody to be on the top. I can't see.
Cari?
Most adult, how long?
Hi, we're running low on time, so it'd be great if we could just quickly wrap it up and then
I sure will. Here we go. Most of my cases are consent versus non-consent. Nurse examiners know that some patients who present to them are not completely forthcoming. Nurse examiners can't tell you when something is consensual or non-consensual. Consistent with will be the common verbiage, although in the last 2 years, they took that off the form. I've been lobbying for that for 15 years. Finally, somebody did it, not because of me, but they did it. And then generally, whatever can be consistent with the history could also be consistent with something other than the history. So I have to keep that in mind. And the nurse examiner is a cog in the wheel. We're not going to make or break that case. Questions or answers? And here's some resources that go along with it. And that's.
I want to thank Nurse Caruso and Dr. Riddle. You both are amazing women, and I'm in awe of the work you've done in your lives. And thank you for sharing all this great information. Celia, let me check first. How long should I talk? Because obviously there's a lot here to unpack and tie it in with trafficking. But it's already noon. So how long do you want me to go?
10 minutes.
Okay.
10 minutes is good.
So again, thank you all for being here. Let me start off by saying, first of all, this subject matter is really heavy. And I know you've had a workshop before, and I'm sure Nurse Cari talked about, some of those images are a little bit hard to look at. So just know that it's normal to have some reactions to this in your body and your mind. And you may think nothing of it now, and then when you're trying to go to sleep tonight, something comes up in your head. And one of the reasons that particularly concerns me is that when we look at the numbers for sexual assault, and Cari, you may have also covered this in your other presentation, it's really, really common in our society. It's sort of devastatingly common. We know that 1 in 4 women will experience a sexual assault in their life, and 1 in 10 men. So one point is that this, we often think of this as something that happens to women by men, but I want you all to realize that sexual violence and other forms of violence, because human trafficking is not just sexual violence, it's physical violence, and most importantly, psychological and emotional violence, which leads to a whole cycle of control, which is the underpinning of a lot of violence in our society. But it can happen a woman can inflict harm on a man, 2 men can inflict harm on each other in the context of a relationship or not. 2 women can inflict harm on each other in the context of a personal relationship or another relationship. So even though we're generally talking about men hurting women, I want you to realize that whatever kind of relationships you guys have, depending on your own sexual orientation and gender identity, nobody is immune from this stuff. It can affect everybody. And it does impact young people more than anybody else. When we look at the statistics of sexual assault in the United States, 40% of people, of females who are raped, have that happen before they're 18. So some of you on this call may have already been harmed in a way that involves sexual violence, whether it doesn't have to be a completed rape, but there's all kinds of negative sexual contact that happens to people even when they're teenagers. If any of you have experienced that, I'm really sorry. Hopefully there's someone in your life you can talk to about it so it doesn't stay in your brain and cause you trauma. But it's normal to have reactions to this kind of information. And I just also wanted to add for males that not only can males be harmed sexually by being touched inappropriately or penetrated inappropriately, they can also sometimes be forced to commit sexual violence on other people. That happens to about 7% of men in their lives. So it's something that we see in human trafficking situations and also in other violent situations where boys and men are forced to commit sexual violence on others. So just to broaden the way we're thinking about rape and sexual violence. So both, I'll build upon what Cari and Dr. Riddle talked about. And I want to get back again to the issue of perpetration and who's doing the harm. So Dr. Riddle was very careful to tell you all to let your friends and family know where you are and to stay with people who are safe, which is really important. But one of the things that leads to harm is that the people who do harm, whether it's in an intimate partner relationship like domestic violence or in a trafficking situation, and I'll explain a little more what trafficking is, the perpetrators will often work psychologically. And the process that Dr. Riddle was referring to online can be called grooming. So basically these people are building a relationship with you and they're teaching you to trust them. They are going through a process that's called grooming, where, and this is something we see particularly in sex trafficking, where it's typically not that somebody's kidnapping you off the street and pulling you into a van and driving away. That does happen. But more often, people are building a relationship with you, often starting online, but sometimes in person, where they lead you to believe that they care about you more than anybody else in your life. It's very common when you're a young person, also common sometimes when you're an adult, that your relationships are strained. When you're a teenager or a young adult, you're angry at your parents, they don't understand you, your friends betray you or piss you off or abandon you, and you feel alone. And people who prey upon others know how to find these hooks in your psyche, and they make you think that they care about you more than anybody else, and they twist your emotions and they cause you to trust them and go against your better instincts. So this is one of the reasons that the youth who are most vulnerable to trafficking are kids who don't have a strong social structure and emotional support around them. So we see high rates of sex trafficking and also labor trafficking, which I'm going to get to, among runaway youth, among kids who are in the foster care system, among kids who have spent time in the juvenile justice system. We also see it commonly among kids who are lesbian, gay, bisexual, transgender, queer, intersex, or other forms of sexual and gender identity that vary from the dominant heterosexual cisgender norm. So my birth certificate says I'm female. I feel like a female. I identify as a female. But I have a lot of friends who maybe were born female and they don't quite feel female. And that puts them in a weird place in our society where they feel stigmatized and alone, and they're very much at risk. So fundamentally, protecting yourself from all kinds of harm, sexual violence, physical violence, and the emotional violence that let people manipulate you comes down to having people you trust in your life and even loving yourself, taking care of yourself, believing in your own core self-worth. And I'm old enough now that not only have I dealt with a lot of domestic violence in my professional career, but I've also seen it in people that I love and care about, or in people that my friends love and care about. And people lose a sense of themselves. They lose their relationship with their friends and family, and they become subject to the psychological pressure of the person who's trying to control them. And all of this stuff is not ultimately about sex. It's about power and control. So strengthening your own core beliefs of who you are and knowing yourself and knowing love for yourself and having people in your life that you trust is the most important thing. Not to say that harm can't happen to you if you have those things, but it will build your strength and your resilience and help avoid situations, along with the practical tips that Dr. Riddle offered for keeping safe online and in reality, in real life. So in the next couple minutes, let me just take a step back and talk about human trafficking. So trafficking is talked about a lot now in the media. The actual legal definition of it in the US is that a person uses force, fraud, or coercion to get another person to provide services for them in some way. So force, we all know what force is. Somebody's beating you, they're raping you, they're tying you up. That is part of what happens, but it doesn't happen in every case. And the thing that surprised me most when I started doing this work, which was 16 years ago, is how much of the manipulation is fraud or coercion. So you trick someone, you say, oh, hey kid, I know you need some money. I know you're looking for a job. I have this great job for you. Come with me. Or like Dr. Riddle said, you want to be a model. This dance club is a great way to get started. You'll get experience performing. You can show off your gorgeous body. And let's come with me. I'll give you this job. And then you wind up having to go service people sexually after you do your dance. Or you decide, hey, I'm going to do that because I want to make some money. And then somebody takes advantage of you there. And then there's coercion, which is often psychological. And that, again, for me, has come to be an incredibly powerful part of that, because the psychological manipulation is something that leads to vulnerability, both in trafficking situations and in intimate partner violence situations, where people will use their words and your emotions to make you feel like crap about yourself and make you believe that they are the only person who can help you and the only person who thinks you have any value. And they often say things to you that make you think that you're worthless and nobody else cares about you. So the forms of trafficking that we talk about in this country mostly are labor and sex. And labor can be any kind of job. Around the world, people don't necessarily say sex trafficking and labor trafficking. It's all trafficking. In the US, we bring sex work, the sex trade, in its own category. But some people actually sell sex to survive. They don't have another way to make a job, to have a job to feed their family or put a roof over their head. So they're doing sex as their job. And some people are in this situation, even though it's a criminal endeavor. And even in this situation, they can be harmed and raped and forced to do something, even though it's their job. And with trafficking, they're being forced to do this and somebody else is taking their money and somebody else is controlling their schedule. But it can happen in any other job. We see it a lot in jobs where more immigrant people work or in jobs that don't earn people a lot of money. So cleaning services, being a janitor, working in food processing, working in agricultural fields, any industry you can think of in our community in the United States, generally, people are being forced into working. And it's often in jobs that we don't think much about these people. We don't give them a lot of respect. And they're being forced to work and they're not getting paid and they're being treated horribly. So when we see this also among a lot of youth, particularly with homeless youth and youth who are not in a great situation already because they don't have a lot of support from their family and they don't have close emotional ties with adults, but people can wind up in really bad situations, whether or not forced sex is involved. So I'm gonna wrap up here just saying that these are common problems in our society. You all are here as Girl Scouts, so you already have some of that really good training and good emotional support and community support. Really important to try to maintain that, even when you're feeling lonely and isolated, which happens to everybody. Stay in touch with an adult in your life and keep good ties. And that spidey sense, again, that Dr. Riddle talked about, when you feel like something's just not right, always pay attention to that. If you wind up in a situation where you're with a nurse examiner, like Nurse Cari, don't blame yourself because, again, this kind of sexual assault is really common. But even if it doesn't get to that point, hopefully a lot of you are going to wind up in college in the next few years. Campus sexual assault is a really huge issue. And again, these aren't strangers pulling you off the street and into their van and driving away. You will be engaging with people that you know. You will be hanging out with people that you have a crush on. You will be possibly drinking and taking drugs. But even if you're not, you're going to be in situations with people that you think you should trust who you can't. And a lot of the rape and sexual violence that we see is perpetrated by people that you know. And those situations are really hard because they can damage your reputation, your social life, even your academic career. So again, if you ever wind up in that situation, whether it's in school or at a job, find somebody you trust to talk to about this with. If you want more information about trafficking, my organization is HEAL, Trafficking Heal, like HEAL, like getting better, .org. And we work primarily to help prevent trafficking by making sure everybody has what they need to live, including housing and healthcare and food and a decent job with a decent wage. And we also, our training is mostly to teach healthcare providers how to see this and how to treat patients respectfully, which you'd be surprised how often people go to the doctor and are treated like crap and not given respect. So we're trying to teach people how to provide what we call trauma-informed care, where you respect people's experiences in their life and you don't get them more upset by what you're doing to them at the doctor's office. So you can find more information there, and you can also email me. I'll put my email in the chat if you have further questions. And thank you all so much for listening and for caring about all these topics, and take care of yourselves.